All right, welcome. My name is Amber Kerrigan, and I am a program manager with TCMS. I'm here with pediatrician Andrea Singh. Dr. Singh, thank you for joining us. And today we are talking about food access and food insecurity and how that affects your patients. So my first question for you is, in your experience as a pediatrician, how do you see food insecurity affecting your patients and their families?
I think as a pediatrician, one of my primary tenets in my job is helping people kids grow and develop optimally. And food insecurity affects that in lots of different ways. It affects it, in terms of physical health. It affects it in terms of, affecting kids' mental health and potentially impairing their development. It also can affect their behavior. If kids are not getting enough to eat during school, they're more likely to act out. The pandemic has really exacerbated an existing problem. Some of the data coming out from the USDA and other sources are saying that, twice as many or even 3 times as many people are food insecure now than they were pre-pandemic. And so it's a real issue that we're facing on a much more consistent basis than ever before.
Wow, I didn't know that recent stat. I had heard that 1 in 6 children in Minnesota face food insecurity, but it sounds like it's probably higher with the pandemic.
Yeah, it may be. And, some of it may be that it was just less before and now it's at that 1 in 6 number. But regardless, it's a huge problem that's becoming more and more pervasive. And for all children, really all families and all people in Minnesota, but we see it in the pediatric offices, in our kids especially.
Wow. So how do you think funding for school meals for all Minnesota children, how could that help address food insecurity?
Yeah, well, some of it is just access and resource. So there's a couple different ways in which providing that funding of universal school meals will be helpful. One is simply in terms of providing the meal itself. Like some people don't have money to pay for food, and that's where the food insecurity comes from. And so giving kids a non-judgmental place and way to have access to healthy food is important. Another way that it'll be beneficial is to help those families that do live in food deserts. Unfortunately, a lot of us are lucky enough to live in the state of Minnesota where, we can run down the street and there's a Cub and an Aldi and a Walmart and a Target and a Fresh Thyme, all like right within your neighborhood or walking distance. But many families don't live in neighborhoods where they have easy access, that they can get transportation to stores that have healthy food. And so providing a place for kids to get that food consistently is a great option.
Yeah. And are there things that you think lawmakers should consider when they are thinking about permanently funding school meals for children?
Yeah, I think one of the important things to think about is that this is an issue that predates the pandemic. We have talked about it as becoming worse during the pandemic, but that doesn't mean it's a pandemic specific issue. And so when lawmakers are thinking about funding programs, I think this is a long-term program that we have to think about to fulfill a need that has been in existence for a long time. Getting healthy food into your body, especially a body that's developing and still developing brain neuronal connections and, your physical bone growth, muscle mass development is critical for long-term health outcomes. So not only would providing consistent meals for these kids provide short-term benefits in terms of, just helping them get the calories they need in the moment, but also help so that they're minimizing long-term negative health outcomes, which ultimately saves the economy money. And so I think lawmakers need to think about all pieces of the puzzle.
Thank you so much for taking the time to talk with me today, Dr. Singh.
You're welcome, Amber. Thanks for asking me.